Okay, so now we will have Dr. Grazinski's partner, Dr. Petrov, talk about his technique for infusion of the stem cells and the integration of stem cell therapy into his CCSVI treatments. Ivo?
I'm not going to bother you. I'm going to tell several practical things about our combo treatment. CCSVI, yes, but as we have seen, there are also not everything is done and complete about the treatment of these patients. There are still unmet treatment targets. As we mentioned, all the panel mentioned that we don't have any predictors about who is going to respond and who is not going to respond. Evidently, mainly in patients above 5.5 points of EDSS scale, they need maybe additional treatment because into the late stage, the neurodegenerative process is a fact, and it's not possible to reverse everything only with opening veins. This was the idea to combine regenerative therapy with CCSVI and endovascular treatment. So the idea is to use two mechanisms of improvement of the brain function. What are the stem cells? They are multipotent cells that they are expecting to have multiple functions at the place where our body needs them, and because the MS is maybe with vascular trigger, but nevertheless it's autoimmune disease, and it's a demyelinizating and neurodegenerative disease. So independently of the CCSVI, there is a process that can be modified by the neuromedication like interferon and so on, but also it can be modified by stem cells, because the stem cells, they have many actions. They are proven during the years, the last 10 years. There are multiple studies about stem cells application in patients with MS. The most probable function effect of the stem cells is neovascularization. That in the case of CCSVI is even more important. Immunomodulation and immunopassivation, it's extremely important because the MS is autoimmune disease. The paracrine effects and the apoptosis reducing, it's extremely important because the MS is a neurodegenerative disease. The transdifferentiation is the least probable mechanism. So the other three are more important. And in case of treatment, of endovascular treatment, for us is very important that the stem cells have a vessel wall healing stimulation, so they are stimulating the neo-intima formation after the balloon angioplasty or stenting. It's important in order to prevent rethrombosis and restenosis. There are many publications. I'm mentioning here the main and the biggest publication about multiple sclerosis and stem cells application. It's important to mention that most of the studies applied the MS into the peripheral vein, and most of the cells, it's proven by radioisotope investigation that almost the half of the cells are staying into the filter of the lung. So a very small part of the stem cells are reaching the brain. So potentially the supraselective implantation into the brain will have some benefit. And nevertheless, most of the trials showed some benefit, despite most of them are using intravenous application. Our approach is to combine CCSVI endovascular treatment and supraselective arterial application of the collected stem cells. There is a study with 50 patients, you know maybe about this, with supraselective interarterial application in Parkinson's disease with 0 complications, so it's quite safe. And because of that, we decided to perform a pilot study, small study, 10 patients. It was approved by our ethics committee about combining CCSVI treatment and the stem cell supraselective application. Dr. Botev mentioned already up to 400 milliliters of bone marrow is collected, and after processing, without modifying, only separating cells, no modifying, we are collecting the suspension to be implanted. The suspension to be implanted is done supraselectively in both carotid and the vertebral artery after the CCSVI treatment. We had, during this time, we had 9 patients, 1 with Alzheimer's disease without CCSVI, 1 with amyotrophic lateral sclerosis without CCSVI, without evidence of CCSVI, and 8 patients with MS, CCSVI, and the stem cell application. These are the patients, the 7 patients that we have treated. In fact, we treated 8, but the last one was 3 days ago, so I didn't include it into the analysis. It's interesting. They're from 19 to 76 years in age, and these are the side effects. No one big major adverse event. We had 1 hematoma at the place of the collection of the bone marrow. Several patients had fever up to 38 degrees Celsius, and several of them had some headache. So this is the complete picture of the side effects of the stem cells, supraselective stem cell application. And it's absolutely true. All the patients had some improvement. What improved mainly, I'm going to show you. The mean improvement is about 1 point, 1.5 points of EDSS scale. The global energy level improved in all the patients. Most of them improved legs and arms movement, and also balance and coordination. It was like a side effect and not expected, but almost all of the patients reported improvement in hearing. We didn't search for this, they shared their experience. Case report, our first patient. She was diagnosed in 2000 to have multiple sclerosis. She was positive for CCSVI. She had EDSS evaluation at 3 points before the first procedure, the primary procedure. She had beside the left jugular and the right azygos vein stenosis, she had right side valve problem, and also in the middle segment. We did balloon angioplasty in the middle segment and also at the place of the valve with quite good result. This is the primary procedure, but unfortunately she had some clinical deterioration into the follow-up visit. It was seen subtotal restenosis in the middle segment of the right jugular vein, and also some restenosis at the place of the valve. We inflated, it's very interesting. This is maybe a scar at the place of the balloon inflation. You see there is a very resistant restenosis, so it's a restenotic lesion at 2 sides, very resistant, and because of that we implanted a stent with very good result. And we implanted the stem cells into the vertebral and also the carotid arteries. The result, the clinical result, is really beneficial. She had no restenosis, rethrombosis, no brain fog, disappeared. She increased walking distance. She had and she has normal sleeping and much better balance and vision. So, some impressions, really initial. The combined procedure is clinically feasible with a good tendency for neurological improvement and absolutely safe, excellent safety profile with zero major adverse events. Quantification of neuro benefit and improvement of quality of life as well as safety profile verification are being investigated through a pending trial. As a conclusion, the combination treatment of microcirculation restoration, so CCSVI treatment, and damaged tissue regeneration, together with immunomodulation, this is the stem cell implantation, will be most probably the routine treatment of the future. A randomized study has to prove the definitive clinical value of this combo procedure. Thank you for your attention.